because you're not aiming to combat, you are working with, right? And so the mind-body connection is really very central when we're talking about lupus and managing your mental health. Mental health generally is very, very important for daily functioning. And the reason we use the word mental health or mental well-being is to emphasize the importance of good overall health, meaning that I am functional in multiple areas of my life or multiple social domains. I am healthy and functional in my physical life. I am healthy and functional emotionally, socially, spiritually, and existentially. Existentially is really just referring to, have I made meaning of my existence? Do I accept or do I acknowledge that I have purpose and value and I have a place in my life? And so when we experience pain and suffering, it's usually very subjective. Each person experiences their pain as themselves. No two people experience pain and suffering in the same way. And so we often have a lot of cliched little sayings like, I understand. And sometimes that could be quite irritating because you're thinking, but you're not living with the pain that I am living with. You're not suffering in the way that I am suffering. How can you possibly understand? And so we have to remember, when talking about chronic illnesses, when talking about lupus, that it is important to work on the mind just as much as you work on the body, to protect the mind just as much as you protect the body. So the battle with pain and the battle of chronic illness that involves pain, what you're seeing here is that the brain, as wonderful and beautiful of an organ as it is, pain in particular affects several neural networks across the brain. And each one of these networks are responsible for a particular aspect of your functioning, right? The brain is responsible for guiding your functioning. It's what makes you you, right? And a combination of your personality, your thoughts, your actions, your responses to your behaviors all come from and are directed by and generated by activity in your brain. So when your sensory motor network is affected because you're in pain and because you're living with pain, the way that you pick up a teacup, mix your tea, the way that you cook or handle the spoon when you're cooking, or the way that you clean out the car, if that's what you're doing, you're going to experience changes across many different aspects of your physical functioning. And because that is the battle with pain. And your executive functioning, the part of you that manages emotions and regulating your emotions. How am I feeling today? Am I overreacting to this situation? Am I underreacting to this situation and passively accepting whatever is happening to me? Right? So all of those parts of you, it's almost like there's an entire separate being of you that is affected and impacted by what is happening with the brain. And pain is one of those things, those real tangible things that affects the intangible, which is your mind and how you perceive things and how you experience things. So you can decrease physical pain, right? Either through, so let's say you're walking down the road and you knock your foot on something. You can rub your toe, you can rub your foot and reduce pain. If you're experiencing deeper and more significant pain, There's medication that can help temporarily reduce pain. When your mind is being affected, because it's intangible, it's a bit harder to see. You can't touch it, but you do have to work on it, and you do have to spend time repairing damage that might have been done, right? And the damage in this regard really is looking at how has my experience of living with lupus affected the way that I feel about life, the way that I feel about myself, the way that I feel about the relationships that I have with people. And so one of the common features of neuropsychiatric lupus is depression and anxiety. And they are more common simply because living with a chronic illness is extremely difficult. And it is difficult to cope with day-to-day changes in your body and reduction in what you were once able to do. And Rihanna mentioned something key, which is the grief and grieving for your life before. And depression is quite common amongst patients that are living with lupus and persons that are living with lupus. And she did call out the common symptoms of depression, so we can just go through it again because it's a little visual capture. But feeling sad, irritable, and anxious, feeling empty, hopeless, guilty, worthless, loss of pleasure in doing your hobbies, including sex, fatigue and decreased energy, feeling listless, feeling like you're too tired, you can't get up, you have no motivation, trouble concentrating or remembering details and making decisions that were once easy, not being able to sleep or sleeping too much, or waking up too early. That's also part of not sleeping or sleep regimen that's incomplete. Um, Eating too much or not wanting to eat at all, weight gain or loss that's unplanned. Now, those two things, if you don't remember anything about the symptoms of depression and anxiety, I want you to remember those two things. If you find yourself having difficulty sleeping or eating, those are your first two indicators. That's the first signal and red flag that we get as human beings that lets us know that our mind is under attack, or our mind and our mental health is being threatened. So not being able to sleep, sleeping too much or sleeping excessively, and we're talking about, let's say 10 hours a day, you're sleeping from dusk till dawn kind of thing, that's the sleeping excessively, right? And we find that we see that often with teenagers when they're going through a lot of hormonal changes and their bodies are now adapting to adult bodies, right? So we notice a lot of sleep and eating habit changes, but it is a key for adults, a key indicator that your mental health is at risk. All right? Thoughts of death or suicide, as well as suicide attempts, are also included here in depression. And so I just want to make sure to mention, especially in this suicide attempts symptom, that this is the one thing that you must always seek help. Thoughts of death, thoughts of suicide, or any attempt of suicide, not wanting to be here anymore, not wanting to live, sharing that with persons that are close to you, all right? Even any sense of starting to share up your belongings or give away things that are important to you, all of those are indicators that you need to reach out for emergent psychiatric or psychological intervention. And that really is just to help you in understanding what you are feeling, because suicidal thoughts usually are not always organic and natural. It is something that can be can emerge or be generated by imbalances in the brain, chemical imbalances. It can be other medications, increased anxiety and stress that might be bringing on those thoughts, right? Medications usually are a culprit in increased thoughts of death or suicide, even if you are dreaming about it. Talk to somebody, right? So that's the one thing that I must impress upon you, to reach out to a mental health professional if you find yourself in this square, right? Now, the aches, pains, headaches, cramps, digestive problems without a clear physical cause. So we're not talking about anything that might be associated with lupus already in terms of your aches, pains, digestive problems, and other symptoms that are being treated separately. Now, just in terms of how depression and anxiety would be diagnosed in a clinical setting, I am going to go through that. So just so you have an idea of, if you're doing some self-assessment, what to look out for, right? So we're just going to talk about anxiety and those symptoms, and they would consist of the nervousness. Now, anxiety here is worry and concern, excessive worry and concern, right? So, thinking about, or you should be thinking about moments when, not where there is valid reason for worry or concern. I'm talking about your child goes to school every day, you drop them. They have been safe at school for the last 5 years because they're in standard 3 or form 3, right? But you drop them off to school today and you stop down the road and you can't leave them, and you want to run back to school and you feel like taking them out to school and it's making you worried, you feel like something will happen. Now, there's a difference between instinct and anxiety. And so instinct and intuition, something that we all feel as human beings, happens sporadically. It's not consistent, and it doesn't happen every time with the same thing. So for example, if every time you drop your child off to school, you feel excessive worry, then you are dealing with anxiety and not instinct and intuition. If one day you have no experience with anxiety and you don't suffer with anxiety, but you drop your kid off to school one day and something just tell you something is wrong, I need to go back. That's your instinct, that's your intuition. When the worry is excessive, meaning that it is beyond whatever your baseline for worry is. If you happen to be a worrier and you worry all the time about everything, then it's kind of hard for you to get a baseline. But you know yourself, and you know that, all right, these things, this list of things here, these are things that give me the most trouble, the things that I worry about the most. And that's the things that you can talk to a mental health professional about. You can run it by a therapist. You can run it by your medical social worker that you might have at the health center, or somebody that might be providing counseling to you as part of, through your doctor or through a health center, right? But there must be some consistency in how much you worry, how excessively you worry, and how often you worry. All right? So, shaking, rapid heartbeats that can't be explained by a heart condition or cannot be explained by any other physical illness. Fainting, again, so if you don't eat for 3 days and then you faint, it's not anxiety, right? So we're just thinking about, are these things standing out to me? Are these things strange to me? What I experiencing unusual? right? And has it been going on for a while? So frequent urination and nightmares. Now, oftentimes, and when I think about culturally doing psychology and my practice over the last 10 years, there are things that are nuanced and unique to Trinidad and Tobago. And so dreams are one of those things, you know, that many people have different interpretation of dreams. And nightmares and night terrors, I often find that my clients that's the one thing they leave out. That's the one thing they don't talk about, right? But it forms part of our assessment of their state and degree of anxiety. And this as forms a part of our assessment of their state and degree of depression. And so I would encourage you to talk about your dreams, talk about your nightmares or your night terrors. Night terrors are the ones where you fly up out of sleep, and you can't tell for those first few minutes, you can't tell if you're still asleep or if it's really happening, right? So those are night terrors, and they're really one step above nightmares. Nightmares would be bad dreams where it feels like it's real, but you are still asleep and you know you are asleep. Night terrors, you're not sure if you're asleep, and it's a little worrying. So there's some medications that can induce night terrors as well, right? But they are very, very important to talk about with your mental health professional or any mental health professional that you might be getting support from, because they do help in ensuring that we have a complete picture and that our diagnosis is correct. All right. So as Rihanna mentioned, the statistics are quite telling that 1 in 4 people, or 25% of persons living with lupus, suffer with clinical depression. And those that have had it before um, continue to experience depression and clinical depression after they've been diagnosed. Now, there's a difference between acute depression, meaning I have it right now, and I have it for a short time because I'm dealing with something that's difficult for me to manage emotionally. So maybe I've lost someone that I care about, a parent, a friend, a spouse, and I feel overwhelming sadness. But I feel it for the period of time that's typical, neurotypical for this symptom. So I feel overwhelming sadness when I have lost my parent. But then I begin to heal and work towards dealing with my grief and my loss. And that's acute depression. You have it for a period of time, but a short period of time. Clinical depression is different because you have it for a long time. I'm talking about our length of time here is most days, most of the day. So if there are 24 hours in a day, 20 out of 24 hours, you feel overwhelming sadness, right? And for 2 weeks or longer. And this is a consistent 2 weeks, meaning you have no good days. If you find yourself in a cycle of overwhelming feelings of sadness for most of the day, for 2 weeks or longer, then it's important to seek some help, because that's going to really going to be affecting the rest of your functioning, all of your functioning. All right. And so just in terms of your motivation to go to work, to get up, to parent, to feed the dog, right? It's all going to be affected by your feelings of sadness. And so diagnosing with clinical depression, and culturally, sometimes you hear talk of, well, that's mad people thing, right? I can't see videos, so I can't see if anybody is agreeing with that. But we suffer in Trinidad and Tobago from misunderstanding mental illness. And it really affects how often people are willing to seek help when they are feeling ill mentally, when their mind is not well,
That's true.
right? We are willing to run to a doctor when we have a stomach ache and when we have a chest pain and my hand hurting and right, my back pain, and but a lot less willing when we don't feel well mentally. But if you're experiencing um, anxiety for a period of 6 months, so with depression, it's 2 weeks or longer. With anxiety, is consistently for 6 months, right? So excessive anxiety, worrying most days, difficulty controlling your worry, meaning that you can't get yourself to have a positive thought or a less worrying thought. Appearance of the following six symptoms: restlessness, fatigue, irritability, muscle tension, sleep disturbance, and difficulty concentrating. Symptoms significantly interfering with your life and your functioning. So, as I said before, you can't go to work, you can't get up, you are withdrawing from parenting, from other relationships that you might have in your life. And then symptoms not being caused by direct psychological effects of medications or medical conditions. And then symptoms that aren't due to another mental disorder, right? So the example I used here, because anxiety and panic disorder are closely related. Now, a panic disorder or panic attack, again, is one of those things that is more acute, meaning that you have a panic attack about a thing that you are anticipating to happen. And you're anticipating, you've worked yourself up with so much worry that you think it's going to be bad. And then your brain starts to shut your body down, close up your airways, right? Increase your heartbeats. It's all just survival responses. And you have a panic attack. And the panic attack, if it keeps happening over and over repeatedly, for a particular thing, then you may be diagnosed with panic disorder. But anxiety doesn't always lead to a panic attack. So you might have moments where, or you might have had a moment where, especially with the fainting, find that there are clients who come in and report, I feel faint all the time. I'll be standing up, in the line at the grocery and I will fall. And they're trying to understand, well, this must be physical. This must be something wrong with my body, that my body is making me feel faint and fall. And as we dig deeper and as we explore their mental health, it will usually be uncovered somewhere in there that there is increased panic and anxiety about something that they might be anticipating. And the panic then creates the panic attack, or the increased panic creates this panic attack and they faint, right? So there are sometimes the lines might seem narrow, and the differences between disorders and how we go about exploring and assessing these disorders are not always, the client may not always understand immediately when we're asking questions and the questions seem unrelated. It's usually because we are trying to form a complete picture of your health. All right, so these are a list of medications that do affect your mental health. And I have highlighted the ones, the corticosteroids, the opioids, and the prednisone, that I strongly suspect many people that are part of this webinar right now may be taking, right? Because corticosteroids are usually used to treat lupus and autoimmune diseases, but the side effects of corticosteroids are depression, mania, anxiety, and psychotic symptoms. Opioids that are used, prescribed for pain relief, Same thing, depression, mania, anxiety, and psychotic symptoms, and prednisone, which treats inflammation, same symptoms and side effects, right? So you may want to talk to your doctor about whether the medication that you are on might have any of these side effects and anything that you might be experiencing with your mental health, especially the depression, anxiety, and the psychotic symptoms, whether they are connected to the medication that you might be taking. All right, and it doesn't hurt, never hurts to just ask a question. No question is crazy and no question is wrong, right? Now I do want to touch briefly, I'm not going to go into too much detail because this again is one of those things that I have a hard time with Trinis, right? Trinbagonians. That they think that psychotic symptoms automatically mean that you're mad, is a madman, you're crazy, is a mad woman, right? And your family starts whispering about symptoms. Now, psychotic symptoms are hallucinations, delusions, and disordered forms of thinking. Psychotic symptoms can be induced by the medication that you're on. Neuropsychiatric lupus also has features of psychotic symptoms as well, because the intensity of the pain that you might experience can bring on or induce psychotic symptoms. Now, hallucinations, seeing, hearing, or feeling things that don't exist. So I would have had a client who would have said to me, Mommy, she, sorry, could you excuse me?
Sure, of course.
1 minute.
Right. So as Monique just pauses there for a little bit, I just want to ask for persons joining who did not participate in the support group question when we shared asking persons, inviting patients to send in their questions. I would like to use the opportunity now for you to send me questions via the chat. I'm talking here on Zoom. If you have any specific questions relating to our discussion this evening, lupus and or mental health. And there are some persons who have not identified themselves, like for instance, Samsung SNA71. I'm asking if you can please identify yourself by changing your name so we can know who you are and what have you. It's important. It's a community. We are not, we don't want to just have persons in here and, we want to know who you are and get to know you and what have you. So Samsung SMA71, I'm kindly asking you to change your name. Thank you so much. Okay, Monique, you ready to resume?
Yeah, really sorry about that.
Mommy duties always come first. Okay, go ahead.
And I was just clarifying what psychotic symptoms refer to, and it really comes down to seeing things. So I was giving the example of a client who said to me, I wake up at night and I see a little girl in my room. And we would normally ask the question, well, have you spoken to the little girl? Have you asked this little girl any questions? Have they responded to you? And so that is us as the clinicians asking and clarifying what is the nature of your hallucination? How deep does it go? Right? How complex your hallucination might be and how long does it last? So does it only happen when you're asleep and you wake up? Because there's a chance that you're still sleeping, right? Does it happen during the day? Do other people see it? So hallucinations are seeing things that no one else is seeing. And so if you, sometimes it can happen if you think that you saw the same car pass 3 times. You might say, but didn't I just see that car? And you ask somebody else, you seen that green car? And they say, what green car? Right? If it starts making you feel confused, then check in with a healthcare professional about it. if you are hearing things. Now there's a very natural phenomena where you, because people can complain sometimes that they hear somebody call their name suddenly. And sometimes you might respond and say yes, and then you realize you're home alone, or you realize nobody said anything. Now that's something that's quite organic, and it happens naturally. It's the brain, when the brain can sometimes be automatic and on autopilot, and the brain tries to make sense of the environment that you're in, and the world around it. So sometimes you're hearing somebody calling you regularly. So you might be hearing your mother calling you all the time, and then a day she's not home and you hear it, right? And so there's it's not quite an auditory hallucination, meaning you're not hearing things that are connected to a psychotic symptom, right? But if you are hearing voices, that is a voice other than your own. So if the voice you are hearing does not sound like you, and it's not your voice that you are hearing, then it's cause for concern. If the voices are telling you to do something, it's cause for concern. The voices are telling you to hurt yourself, it's cause for really significant concern. All right. And then feeling things that don't exist. If you're talking about suddenly start, I'm feeling really cold, I'm shivering, and you're not feeling cold, but we're not talking about just feeling a slight chill. We're talking about feeling cold, like you need to go and put on a sweater. Nobody else is feeling cold. Everybody else is at normal body temperature, and you are freezing, feeling things that don't exist, all right? Or that no one else is feeling, hearing, or seeing. So before we jump into coping strategies, because this has really been a lot, and we try to make sure that we're always providing some educational component. So understanding what you are dealing with is an important part of managing how you deal with it, right? So the first part of this talk is really about providing education. And then we go into the second part, which is about coping and managing how you're dealing with it, right? So do we have any questions or concerns about the first part?
Not hearing anybody responding.
No, I'm not able to see anything in the chat either. So if
Yeah, I'm not seeing anyone saying anything, so I take it we can proceed forward. Thank you, Monique.
yeah, okay. So one of the other things that, or the other two things that you may find yourself plagued with is isolation and loneliness, and then difficulties in relationships. Now, persons living with lupus and experiencing a chronic illness, or the effects of a chronic illness, would typically seek out isolation. And that happens because you're seeking peace, and you're seeking quietude, solitude and quiet, because you are trying to deal with what you're experiencing. And what we need to be just aware of is, how isolated am I? How lonely do I feel? If you have withdrawn from everyone and everything in your life, then the isolation is no longer serving you. It's no longer a benefit to you, and it's no longer working towards improving your condition. It is working against you, because it's creating loneliness. And the isolation has become a negative, like an axe breaking you down, because the longer you stay with your own thoughts, especially if those thoughts are negative, the worse that it can become, and the longer you can become stuck in a cycle of negative thought patterns, right? And the isolation here as well is, I'm not talking about, you run away for a day and, or you take a vacation by yourself for 3 days and come back. I'm talking about weeks, months, even a year or more of isolation. So you quit your job, you break up or end your relationship with your partner, you stop visiting your extended family, you stop the clubs and the programs that you were involved in before, you stop doing those. If you used to garden, you just let everything, all the plants wither and die. And you find that you have forced this isolation on yourself. The trick here is to recognize whether it's something that you have done or something that happened as a result of, um, you know, your belief that people aren't willing to or people don't want to deal with the negative effects of living with lupus that you might be experiencing. So sometimes we find that patients would isolate themselves because they are afraid of burdening family and they're afraid of burdening friends. And then you're forcing yourself into isolation, and hiding in the hopes that that may make it less burdensome for the people that you love. But that works against you, it's going to be vital, and I'll cover this later on. It's going to be very, very vital for you to have a support system. And where relationships are concerned, and I don't know if anybody wants to jump in here and just talk about one or two of the challenges that they might have had in their relationships, because what I often hear would be, well, my partner doesn't understand that when I say I'm in pain, they don't appreciate how much pain I am in. Or when I am having a flare, they think I'm making it up, or they think I'm being dramatic when I describe my symptoms and I describe what I'm feeling, or they think I'm being too much when I am sick every week, right? So I don't know if anybody wants to jump in here, maybe describe or just mention one or two challenges that you might have had in relationships with others.
Yes. Are you hearing me?
Yes, hearing you.
Good night, everyone. My name is Sharda Ramsing, and I am a lupus survivor. I can relate quite clearly to what you're saying with your other half, because I was diagnosed when I was 39. I already had my husband and my kids, but he didn't understand because I look good, but I didn't feel good sometimes. And he didn't understand how you're not feeling good in the morning, but when time to go to work, you're all looking all pretty and nice. But I started getting up on the bed was a challenge. I limit all my activities because I don't want to go walk too much because my foot is hurt, and you constantly tell them, oh, I can't eat this, my digestion, I don't feel good. And he feel like you were just pretending because you have a sickness now. And many times you make a remark, I can't handle a sick wife. I can't handle a sick wife. As a woman and as a mother and as a wife, we give 300+% out there.
Mm-hmm.
When your husband say these things, make you feel like you're a liar. It makes you feel that maybe I'm doing something wrong. Maybe it's all my fault.
Yeah.
But it's not like I want to be sick. It's not, I want to be doing things that I used to do when I was young. I was being in the prime of my life. At 39, 40, I'm 46 now. And, well, okay, he didn't want a sick wife. He didn't treat me well. And we broke up 4 years now.
Yeah.
And that depression, I lived with depression and anxiety for more than 4 years. That was, suicide was my first thing. I thought about suicide so many times. Like there was no other way. There was no door. It's a sealed room. I couldn't see the light. I couldn't. But with prayers, and my family didn't left. My mother, I have those days where I feel like I just scream. Just scream and don't stop. I can see love. I had my children, but they were not giving me that comfort that you need. Because there's something your spouse and you could relate to sometimes that, hey, you stress a little bit, you get diarrhea for a whole month. You get indigestion for the next 2 months. You walk too far, your ankles swell up, your knees swell up. Or you feel like if you shake your hands out, it will fall out. Every day is such a different thing with lupus. This out here, little makeup and little nice clothes is just a band-aid over what we go through.
Yeah. And one of the things that I hear quite often as well is I want to be able to talk to my spouse. I want to be able to talk to my partner, but every time I share with them how I'm feeling, they get upset and they start feeling overwhelmed. And then I'm left with nobody to talk to, and I'm left with nobody to share my challenges with. So a lot of patients as well stop sharing, stop talking to their partners and their spouses. And they start internalizing it and keeping it in. They don't talk to anybody.
Yes.
You need someone, it's true. You need someone to just listen. That's all we need. Someone to listen, a little compassion, a little bit of, at least show that you care, because what we're going through is so much. And we just need someone to be able to understand the small things. Oh, you're getting so big and fat in the house. You eating. What happened to you all of a sudden? You done the wrong food. Why are you going to go to the gym? Yeah, I really want to go to the gym, you know. I really want to lose this weight, you know. You know something, I'm afraid I go to the gym now and I overwork my muscles now and I end up with pain. I can't get up to go to work. I get a flare. You understand? I can't quit my job and leave and go for a year and take a relaxation. So I can't do that. I can't afford that. And none of us can afford that because I need my treatment. I need my medication. I need to live. I can't do that. Mm-hmm. Maybe if I had a spouse and who was supportive, maybe I could have done that. Say, okay, with lupus, I am going to take a zone out, take a year leave from my job, and I'm gonna but I can't. We need someone to just listen to us. Listen. We are human. We are human too.
Yeah. Monique, I see that there's someone on they have their hand raised. That's Elizabeth. Elizabeth, you wanted to join the conversation? Sharda, thank you so much for sharing.
Hi everyone, good night. No, I'm not pressing on my camera inside my bedroom in darkness.
No problem.
I just want to share as a married person. I've been married it's going on 7 years, and it's not easy, as Shada said just now. She was saying that, you know, you need somebody who is very supportive and thing, but it's not always like that, because I'm with my husband. We together 11 years, and even though he is very, very supportive and he's there because, well, he don't believe in divorce. He believes we need to stick it out and go through what we have to go through. Sometimes it's still challenging for him to understand what it is I'm going through, you know, as us being a very young couple. You know, sometimes I always need help. Every little thing, to pick up a bucket, to open a jar, to the simplest things, and I always feel like I'm a burden, you know. It's like I'm always nagging this man, come and help me with this, come and open this, come and do this. You could hang up the clothes, you could. So it's like he's not the type to complain, but you could see it in his movements, his actions. He'll walk around the house looking like, gosh, this guilt sickness, but he wouldn't say it, and again, very personal here. In the marital bed as well, that is something that is very challenging too.
Yeah.
Because being sick and in pain all the time, I'm not in the mood for that.
Right.
So you always have to, it's like I'm making appointments. Okay, today I think I will try, or the next day I will see. But when that time comes, it's like, nah. And sometimes, even though he don't complain, as a man, he feeling a kind of some type of way because he have a young wife and he's a young man. Is like, do I need to be going through this? So sometimes I'll be walking around here feeling like I'm a problem. I need to get out of this, because I think I'm holding this man back.
Yes.
So
we're being really
it's very challenging, being married and trying to understand how he feels too, because he's not one to talk either. He wouldn't sit down and say, but girl, I had this problem. So you have to be walking around guessing if this man have a problem. But you would know because, he have his moods and how he would think. So it's very challenging. And I just want to share that. So even though I have somebody here who is very supportive, it's still the same way. Somebody you could talk to, but it's still challenging.
So Elizabeth, I would ask you the question, because you said that you have a supportive husband, you have someone who is understanding, who loves you, cares about you, you're together for 11 years, right?
Mm-hmm.
More than a decade.
Yeah.
And you think, what I'm hearing you say is that you think that this person loves you feels like you are a burden. Has he ever said those words?
No, he always say, I don't know why you just be thinking like this, I feel up tell you, it's not a burden and I'm still here with you.
I'm smiling, Elizabeth, because it's very, very common for us to feel like we don't deserve the depth of love we receive sometimes from people. And your husband, it sounds as though he really loves you and really cares about you, but you don't feel like you deserve that kind of understanding and that kind of love, that somebody would stay with you and be with you, even though you are having the kinds of difficulties that you're describing, right? So sometimes we also have to look at whether or not we might be projecting our own feelings of insecurity onto the people that we love, because it isn't always that they feel that way, and it isn't always, even when they aren't brilliant communicators and they don't share their every thought with us. If he has said to you, I don't feel that way, sometimes the responsibility is on us to trust the people that love us, to trust that when they say, I don't feel that way, that they mean it. Because half of your worry and anxiety is coming from you thinking that he does feel that way.
That's true. I do have a big insecurity because of, being sick, and he's a very young, tall, handsome guy, so
Yes.
yes, it has a lot to do with trust issues and insecurities of being sick.
And so the question is, do you think you deserve a tall, handsome young man being in love with you and supporting you?
I think that has a lot to do with the depression and what we're talking about mental health right now, because I think I do deserve it, but I don't think he deserves, what he has to face.
Right. Okay. So let's talk a little bit about coping now, right? And so I'm not sure if anybody else has any other questions, but I wanted to jump into this. Anybody, Rihanna?
I'm not
Any
seeing
other
any,
questions?
I'm not seeing
No?
anyone
Okay.
raising their hands, so we can proceed forward.
So let's talk about these coping strategies, right? And these, I'm going to give you the ones that are things that are, you know, seemingly very basic, right? And then I'll share with you my favorite coping strategies. So some active coping strategies. First thing, seeking out appropriate levels of information about your illness. So you're doing that already. You know as much as there's to know about lupus, and you have read all of the studies and the brochures and the research, and you've talked to your doctor, you've talked to 4 or 5 different doctors. So you're getting that information. The preparing questions for the persons that are responsible for caring about you and bringing those questions to your appointments might be something that you're now starting to practice, depending on how long you have been living with lupus, right? So question everything. Question your medication. Question symptoms that you might be having. Question feelings you might be having. And bring those questions to the persons that are responsible for your care. Because getting in the information and then having the questions are going to help you regain a sense of control over your life. The most important bit, though, is learning to advocate for your needs. Advocate, advocate, advocate for yourself and your needs. You're doing this not just with your doctors, you're doing this with people you are in relationships with. And you can be in relationships with your parents, your siblings, people at work, right? Relationship is broad here. This is not just spouse or romantic partnership. Relationships include your children, right? Advocating for your needs with the people that love you. I know that there is a worry and fear that if I start advocating for myself, if I start telling people I need more support, or I need more understanding, or I need more empathy, then they might get angry because they are dealing with too much. I am too much. And you start, those thoughts start taking some roots, right? And blooming whole trees. But advocating for yourself allows you to feel like you have some sense of control. And control is what helps you tackle any mental unwellness that you might be facing. You have to start with control. You have to start in a position of owning what you are experiencing and being in control of the steps you're taking towards getting better. All right, so that would be the first one. Then I have this little activity that I do with my patients called your network hand, right? And so you just get a piece of paper and you draw your hand on it. And for each of your fingertips in those 5 spaces, you are listing people who support you, people who listen to you, people who believe you when you say that you're in pain, and people who do something to help you. Now, these 5 people, right, may be people who are always supportive. It could be people who you found were sporadically supportive, but still always genuine about their support. Meaning, because not everybody is always able to be there and be present, but sometimes when they are there, you find them to be very helpful. So even if they're sporadically helpful, they're genuine when they help, right? So they can also go on your network hand. But having this stuck somewhere where you can see it reminds you that you're not alone. And it reminds you that you have people that you can call on if you're in a really, or you're having a really difficulty, right? So your network hand, identify a support system and learn to ask for help. Now I know, and I think someone mentioned it earlier that, as women, you do so much, and you do. I know that men also think they do a lot, and there are men that do a lot, but all the little details, the picking up stuff off the ground, the wiping down a counter, the putting clothes in the basket, there are tons of tiny little details that keep a house just afloat, right? Keep a house running. And you find that women are so used to doing that. And persons who have a tendency to be helpers in their own lives or other aspects of their life, have have a lot of difficulty, with asking for help, saying to others, I need help. I can't deal with this, or this is a problem for me, right? So asking for help takes practice. It literally takes you looking in the mirror and practicing how to ask for help, because that is a real struggle for many, many people who are helpers, right?
I can attest.
Thoughts, yeah, yeah, I'm sure you can. Thoughts are not facts. Okay, thoughts are not facts. When I think, and Elizabeth, forgive me for using your example, when I think that the person that is showing me love and support deserves better, you have to challenge yourself when you're having the thought, is this true? What makes me, as a person having this thought, what gives me the authority to question someone else's choice? So Elizabeth was saying, my husband is here, my husband is providing support, my husband is providing love. That is his choice. He is choosing that every single day, choosing it. And when you have a thought that I don't think he deserves this, you are questioning his right to choose to love you. And if you love someone, you allow them the right to choose, to be with you, to support you, and to love you in the way that they are doing it. All right, so thoughts are not facts. And when you put some space between you and the way that you react, then it changes the relationship that you have with your thoughts, right? It changes when you question and challenge your thoughts. Is this true? And your immediate automatic answer is, yes, this is true. You don't deserve this, right? Because that's your automatic response. That's your feelings of insecurity, your worry, your panic telling you, yes, this has to be true. But then the next step is to ask yourself, is it 100% accurate all of the time? And a thought doesn't pass the test. A thought doesn't get right to live rent-free in your mind if it isn't 100% accurate all of the time. So is this person showing me love and support all of the time? No, maybe not. They show it most of the time. Yes. So therefore, saying that this person does not care for me, or saying that I am too much of a burden for this person, is not 100% accurate, because there is room to change whether or not that thought is true. And once there's room for that thought to become untrue, then it's not a fact. You get me?
Yes.
So how does this thought make me feel? Right? And this is important. Sorry, Elizabeth, I really liked and appreciated both yourself and Sharda's examples of spouses and relationships, right? I am thinking this person does not understand. This person does not care. This person does not deserve this. How does this thought make me feel? You will almost always, in every single instance, develop a storyline, a narrative about what you are thinking. So most times what we do is we pop up with a thought, a single, simple thought that then grows kind of like Inception, if anybody's seen that movie, right? Grows like a seed planted. And around this thought develops an entire narrative. And then off of this narrative, you start deciding how it makes you feel. I'm angry, I'm hurt, I feel rejected, right? I feel ashamed. And those thoughts start dominating all of your feelings. Everything becomes this story and this narrative that you've developed in your mind from one thought that wasn't quite a fact. And so you then have to ask yourself, what would it be like if I didn't hold so tight to that belief? How would I behave? How would I treat my spouse if I didn't really believe this thought, or if I didn't treat this thought like a fact? And this thought was something that could pass and change and diminish over time, right? What would I be like, or how would I behave if I weren't treating this thought as a fact? So those are the four things that you challenge yourself with. When you find a thought that is negative, a thought that's intrusive, a thought that you can't get rid of, nobody loves me, nobody wants me, I am unattractive, my family's fed up of me, I am a burden. All of those thoughts are not facts. And so you challenge them against these four things. Is it true? Is it absolutely true? How does it make me feel? What is the story I'm telling myself about this thought? And what would I behave like, or what would I be like if I didn't hold on to it? All right, any questions about that? No questions? So the next coping strategy is self-compassion. And it's really, it seems like a simple one, but it's not. And there are days when I struggle a lot with self-compassion, right? And it's what self-compassion asks of you is to treat yourself just as kindly as you treat others. And so, you know, the care and concern that I show for others, especially my family or people that I need, if I don't show that same kindness to myself, then I am doing myself a disservice. I am being unjust to myself because I deserve to treat myself with as much kindness and compassion that I treat others. And recognizing that you are part of a common group of beings called humans, and that we all share experiences. We all have pain, we all suffer, albeit in different ways, some of us very different ways, but we all suffer and we all have pain and connection to people and compassion for yourself as part of this group called humankind, and the fact that you are experiencing pain gives you the opportunity to connect with others, right? And then mindfulness, and we'll talk about mindfulness and how we go about practicing mindfulness. But it is simply being present. Mindfulness is about understanding and awareness about what you are feeling in every moment. Being able to say it out loud. Right now, I feel hurt. Right now, I feel alone. Right now, I feel scared. And even when you are lashing out in anger, understanding that there are layers to anger. Anger is one of those surface emotions that are up there, and it stands there covering all of the other real emotions below it. So sometimes it has nothing to do with something, or the way somebody said something. You thought that they were rude and you're angry. And when you really examine it, when you really look at it and how it made you feel, you found that, well, I feel hurt that they thought of me that way. I feel offended that they would put me in that category. I feel ashamed that they know this dark part of me and they're saying it out loud. And so what comes out is anger. But the real emotions are all the other ones: the sadness, the loneliness, the hurt, etc. Right? So we can acknowledge that we are suffering without exaggerating it, without making it the center and the bane of our existence, and everything in our life is about our suffering. Being kind to yourself is giving yourself a break, and being empathetic and compassionate to yourself, and not making yourself focus on constant suffering. Right? So we have two things that we use, and this is a really good key takeaway thing that you can do at any moment, wherever you are, quickly in your mind. You could grab a piece of paper and do it, or you can just kind of visualize it in your mind. It's called circles of control. In a circle are all the things you can control. Outer circle is all the things you cannot control and you must let go of. So the things you cannot control would be the circumstances that you are dealt, the way that other people behave, the way that other people think, the way that other people judge you, the weight of other people's decisions, trying to predict what will happen, right? Illnesses, disasters, loss, how long things will last, how long will I suffer, the weather, politics, right? None of those things are within your control. And so none of those things are things that you should commit time and energy and effort to focusing on. The only thing that you can control are your own actions, your own thoughts, your own attitude, the way that you care for yourself, the boundaries that you set with others, how you use your knowledge and your skills to help other people, how you treat other people, how much grace and mercy you extend to others, and how you work. So those are the things that are in your control. And so when you encounter a situation, you're doing a quick 2 circles. What part of this is in my control and what part of this is outside of my control? If it's outside of your control, the quickest way to reduce your stress is to let go of the things that you know immediately are outside of your control. So somebody does something at work, behaves, you go, you ask for time off because you're not feeling well and your boss says no. That is outside of your control. What was in your control was advocating for yourself and asking for the time off because you recognize that you need it. How they respond outside of your control. And so getting or allowing the things outside of your control to make you feel stressed and depressed and sad and anxious will begin to affect you physically. All right, because when we're experiencing mental distress and mental ill health, it starts to take a toll on our bodies physically. So just imagine that that is going to be layered on top of what you are already experiencing. All right, so every time you encounter a situation, you can just do it quickly. What part of this is in my control? What part of this is outside of my control? What can I focus on? All right. And my last and favorite thing is called radical acceptance. All right. And so I do this with a number of my patients that are in situations that they are unable to change, either because, and I've said before that I work primarily with children. And so a lot of my kids are under 18 and cannot get out of abusive situations or homes that are difficult and feel like hell. All right. And so we work on radical acceptance. Now, acceptance does not mean that you agree with what is happening to you. And it does not mean that you are not willing to change it. Radical acceptance, crazy, unwavering acceptance is just for you. It is just so you give yourself the chance to be at peace long enough to be happy. All right. So before we change anything, before we correct any part of our situation, we must accept it. Because rejecting what is real and rejecting what reality is clear to us is not helpful. And so the part of reality where I am not well, I have lupus, this is how it makes me feel. This is what symptoms I experience. When I take this medication, this is how it affects me. There are parts of reality that cannot change. And there are parts of your reality that you know what they are, that in order to get better and in order for you to be less stressed, in order for you to have some peace of mind, you need to accept it. All right, but again, acceptance does not mean you agree. Because when I tell a client who is that's under the age of 18, a 16-year-old girl who's in an abusive situation, and I talk about radical acceptance, and we work on radical acceptance, it is not saying she agrees with her situation. It is not saying that she's not going to do anything to change it, because the parts, it goes back to the circle of control. The part that is within her control are her thoughts, her actions, her behaviors. And the same is true for you. The part of what you are dealing with lupus and the part of your experience of lupus that is in your control is your thoughts, your actions, your beliefs, and how you behave. All right, so in order to have peace of mind with what we plan to do, what we hope to do, what we want to happen, we need to be able to accept where we are. Because acceptance is going to be key to any kind of progress moving forward and mental wellness, right? So mental well-being and mental health. So when you're practicing radical acceptance, you're asking yourself, what is the situation? What led up to the situation? Which things I can control, right? So you're going back to your circle. Which things can I control? How did I react to the situation? What is the reality? You accept and acknowledge the sad emotions that you are feeling, the anger, the disappointment, the regret, the hurt, the pain, the jealousy, the offense, the shame. You accept that you are feeling those things. And then you ask yourself, how would I behave if I accepted the reality? So back to borrowing Elizabeth. If Elizabeth accepts the reality that my husband loves me, my husband knows that I am living with lupus, and I am not a burden to him, will I behave differently if I accept those things? Right? So when you get some time, try to practice what radical acceptance is for the situations that are most confounding, the situations that you're struggling with the most and that you have the most negative feelings about, even if it is lupus itself, and then walk through what is the reality of the situation, accept what you feel about it, and then challenge yourself, how would I behave now that I have accepted the reality? All right, and the last little coping strategy is prayer, mindfulness, and meditation. And prayer can be anything that you practice as prayer, right? Mindfulness is, again, being present in what you're feeling, being aware of what you're experiencing. And the meditation here really is contemplating positive. So all I'm doing is I am thinking about, in quiet and in isolation or solitude, I am thinking about what I am grateful for. I'm thinking about what is positive and good or going well in my life. And I am focusing on those things for a few minutes for the day. Now, these things that I've listed here are just some free apps that you could download on your phone, and you can manage your mindfulness, right? So just to make sure, just to keep you on track, because I am a person that kind of needs a little help staying on track sometimes. So I use apps, I use calendars, I use tools to help me, right? So Headspace, Insight Timer, Smiling Mind, My Life Meditation, and UCLA Mindful are all really great apps that you could download on your phone. They're free, except Headspace. I think Headspace, there's a small fee for that, but the rest of them are free. And you can just walk yourself through, with the help of these, some practice in being mindful and being aware of what you're feeling and present in how you are experiencing your day. All right, so that brings us to the end of all of the coping strategies that I have for you. If you have any questions, comments, criticisms, concerns, feel free to share them now, and I can maybe stop sharing so that we can take the feedback.
Thank you so much, Monique. And we should say Dr. Monique Martyr, soon to be. Thank you so very much for lending your expertise and helping us to better understand that, you know, to feel sad, feel hopeless, it is normal, but we don't stay there. And if we find ourselves staying there, it's important to reach out for help. I think in a nutshell, that is what it is. And sometimes I can also attest that it's so difficult sometimes to ask for help. I'm accustomed asking for help for everybody else. But when it comes to me personally, it is a real struggle, and I'm learning how to implement certain mechanisms for myself, because the burden of lupus is very real, especially when you're living with chronic pain, fibromyalgia. It's very, very life-altering. And I want to encourage patients who are on right now to you know, this is a conversation. I know Monique will have to leave just now. But before she leaves, I certainly would like to just call on a few persons, you know, to just, you know, questions. I know I have a list of questions that was sent via our WhatsApp support group. But before I go into that, for those of you who are live here, you know, you can feel free to unmute your mics and yes. Okay. So comments thank you for the information. I really appreciate it. I have no question because you answered most of them. So you did a good job there. On Facebook, trying to access Facebook, one person asked, how do you manage stress without activating the disease symptoms?
Right. So, and then if we think back to some of the coping strategies we use, the goal here would be to catch it before it becomes negatively impactful, right? So you personally, you will always know when something is a source of your stress, when a person, a situation, an environment, right? So let's say that you happen to be sharing a house with your in-laws and your mother-in-law is particularly intrusive and it's a source of stress for you. You are aware at all times what your source of stress is. It may not be the person, it may not be your mother-in-law, the person, the human. It may be the things that are said. It may be the tone that's used. And so part of preventing you from activating your or having a lupus flare as a result of stress, it would be important for you to recognize what your triggers are, right? And so if every time she says, is so you live in the house, this is a trigger for me. If you can, get up early in the morning and leave the house before she wake up, right? And if you can't do that, start laughing about it. Because if you know that in 5, 4, 3, 2, 1, she's gonna say, "Is so you live in the house?" It starts becoming less and less of a trigger for you. But recognizing what your triggers are reduces the effect that the stress has on you. All right, but you have to know what triggers you, what throws you into distress, right? Or emotional distress.
Thank you so much. Someone wants to know, you talked about having a supportive significant other. What about if I prefer to stay at home? I don't mind going out once in a while, but I cancel on everyone last minute because sometimes that's just how lupus works for me. I prefer not to be in a relationship because I just don't have the energy or the zeal. Does that mean I'm depressed?
So choosing, and this was something that I touched on earlier, choosing isolation is a cause for concern. Now, there's a difference between saying, I am happy in solitude, I am happy alone, and I am content and fulfilled alone. But if you are alone and you are not content, you are not fulfilled, you don't feel happy, and you're choosing isolation out of fear of being a burden to somebody else or out of fear of being inadequate in a relationship, then it's not depression, but there are things there that you need to talk about, right? Because what's driving your isolation is fear and not contentment and happiness.
Okay.
I hope that answers.
Yes. Someone wants to know, they've just sent a message privately. With regards to the marital bed, how do I communicate with my significant other / husband, boyfriend, girlfriend that I just cannot perform?
Okay, so communication is, and I know, Rihanna, we talked about this, right? Because this came up in the last session as well. Communicating is it's probably an entire webinar by itself. All right, but what I can say is that there's also a great book on love languages, right? And understanding your partner's love language. And so when you describe not being able to perform, I challenge you with the same question that I asked Elizabeth. Is that your perspective that you might be projecting onto your partner? So that's the first question you have to ask yourself. Do I really think that what I am able to do is not sufficient? So when I say I'm not able to perform, am I saying I don't think I can satisfy my partner? Or am I saying I don't think I can have sex ever for the next 50 years, right? So just clarify what you are thinking. What is the narrative and the story that you have told yourself around this thought about not being adequate, right? Because the inadequacy in sex and in the marital bed or in the bed with your partner extends to inadequacy you might feel in other areas of your life. And so it wouldn't be just that would be a source of anxiety and worry for you. And what you're trying to communicate to your partner isn't going to be, I think that I am. It's going to be a question. Have I been inadequate? Because you are not projecting onto them, you are asking them and seeking, because that's how conversation and communication should work. You're asking if your thoughts are real and accurate.
Okay.
Yeah, I hope that's helpful.
Yes, someone is asking about gaslighting in terms of, you know, the issue of gaslighting where your significant other, your partner, refuses to take your complaint seriously and starts gaslighting you into believing that it's all in your head and you need to break out of this cycle of saying, I'm not well, I'm not sick, and they're forcing you to just get up and go.
Right. So there are two sides to that. There are partnerships where the partner believes that they are doing something helpful by trying to be a personal cheerleader, and I am just getting you to get up and go, and they believe in their minds that they're doing something helpful, right? So my first thought would be to have that person clarify with their partner what they think they're doing, right? So you're asking your partner, what are you trying to accomplish or achieve by pushing me to get up and go? What does that mean to you when you say that? What do you think should happen? You think I should just forget that I am sick and get up and do things around the house? What is the expectation, is what you're trying to ask, right? The other side of that is where that person, where there's no positive or well-meaning intent, and that person is doing the essential or the essence of gaslighting, which is a negative and emotionally abusive practice in partnerships. If your spouse is telling you what you are experiencing is not real, it's in your head, you're making it up, you're a liar, that person is gaslighting you, and that's emotional abuse. That is not somebody who thinks they're doing something good and supportive by trying to get you to get up and go, right? So you need to make sure where that person is coming from. And you need to make sure that what they're doing is gaslighting you, or is it that they think they're doing something positive, right? And so you can continue the conversation from there.
Right. Questions were asked. I'm not sure if you would want to delve into going down the route of discussing drugs, but I know we shall proceed with caution here. But someone wants to know, how to deal with the withdrawal from the medication that's used to treat antidepressant. I'm trying to paraphrase what they say. They're asking how to deal with withdrawal from medications used to treat depression, as well as seizures and other mental health related issues.
So, yeah, this is not something that I would go into on a webinar, because this is, blanket statement that you should always consult your treating physician.
That's right.
To discuss any effects that you might be having as a result of the prescribed medication. All right, so unfortunately, I won't answer that.
Yes, of course.
All right,
we're gonna leave this. Yes, we're gonna leave that for you to have a discussion. And when I say you, the onus is on you, the patient, to bring this up whenever you are going to see your doctor, whether it's in the clinic or privately. Someone wants to know other resources that that is accessible for free here in Trinidad and Tobago. What are some of those resources? Where numbers, where can I call for assistance or to get resources for free?
All right, so I have a list. All right.
Email it to me and I will share it. Yes.
Yes. All right. So there are a host of different resources, and we've found that within the past 5 years or so, they've now been spread out into satellite offices, so they are accessible across the country and are able to provide free counseling or mental health care to patients across the country. So I will send those to you, and you can share them.
Sure. Before I refer back to the list of questions that was sent, Dana Hines Elaine has a question. Her hands is raised. Yes, Dana, you can proceed.
Hi, good afternoon.
Good night.
Hi.
You all hearing me, right?
Yes, loud and clear.
Yeah.
I wanted to know, in terms of, can someone be high functioning and suffer from depression? So, or is that a trick your mind plays on you? Can you be high functioning and depressed? And in terms of, if yes, because I consider myself as being very high functioning, but then there's a heaviness that always follows, and then there's a crash and burn. So in terms of that, I wanted to know if that is a real thing, and then how you try to balance that.
Right. Like you described me, Gil.
But I was saying in my mind that that is the two Aquarius up inside so I will switch off my mic now and listen to.
Sure.
In a simple word, the answer is no, right? So let me just explain why you can't be high functioning and suffer with clinical depression. To be high functioning, or what you might consider high functioning, meaning that you could get up, you can go to work, you can perform your duties, you can, babysit nieces and nephews and play with them, you can take care of your dog, but you feel sadness and you feel overwhelmed and you feel heaviness and you feel disappointment about the future and, worry about your prospects. That isn't clinically diagnosed as depression, because what you are experiencing and what you're feeling are feelings of sadness, are feelings of, worry about your future. But the difference is that it is not happening for the majority of your day for 6 months, for a period of 6 months or period consistently for 2 weeks. So if you have intermittent periods of sadness, what you are experiencing is acute depression when you encounter something overwhelming, right? So for example, if you are struggling with fertility, for example, and you are worried about, will I be able to have kids? And you are otherwise okay, you get up, you go to work, you do what you have to do, but then you go to the park with a friend and you see a little baby and the baby looks cute just like you, and you get instantly sad about, I wonder if this will be possible for me, right? That's acute depression. You're having a moment of overwhelming sadness and worry and anxiety, but it has not started affecting you to the point where you don't shower, you don't go to work, or you quit your job, you are using antidepressants or you're using drugs to help you maintain a good mood. All right. So if you don't need to use stabilizers to help you maintain a good mood, then it's not clinically affecting you or chemically affecting you. All right, so it's not quite high functioning, it's acute depression rather than clinical, long-term, or complex depression.
Right. But in terms of, so you would have been on medication periodically. So there are moments when you do need the medication, you are given the medication, and you would feel well for a very long time. I mean, is it that what I'm trying to figure out is that I know the illness can play tricks on you,
Yes,
right?
yes.
I
And the
also know that the medication,
medication,
yes, the medication as well play tricks on you. Now so let me not put this across as I am speaking about somebody else. So I'm talking about me, right? So I am able to function. I am able to be there for everyone. I am able to do my wifely duties, motherly duties, still show up and show out when the job requires me to. I'm always trying to still be the Dana that I was before being diagnosed with lupus, right? But then there are these instances where, and they come and go so frequently that I would go into these spaces where it would be somebody say something, reference me and my illness, or it may be sometimes I don't even know, like literally, I don't even know what is the cause of me not being able to sleep, not being able to eat, not being able to keep down anything. Because I cope well, I have coped and managed well for the last, maybe out of the 12 years I've been diagnosed with lupus, I have coped well for 10 out of the 12 with the medication, and I mean physically. But over that 12 years, I would have struggled a lot with my mental state. But I function. This is the thing. I am able to function and do everything that I am accustomed doing. So I was trying to figure out.
I think that sometimes people confuse functioning with contentment. And you may be performing a series of actions or fulfilling things that are expected of you as a wife and a mother, right? Preparing meals, making the bed, cleaning up. You're performing functions, whether you feel joy, contentment, happiness consistently is something else. So you are saying that it's affecting your sleeping, it's affecting your eating, and you don't feel happy, you feel sad. Then yes, that is depression. And because you are able to do a series of actions that by now we're probably doing on autopilot because you've been doing it for so long, does not mean that you're functioning, because your well-being, your emotional well-being is still very much at risk, all right? And it's still very much under threat from depression and from anxiety, because you might be doing these things just automatically and you're not thinking about it. So that's not functioning, because you're not sleeping and you're not eating. And those are the first two signs that our brain/body give us that something is wrong with us mentally, right? So it's not, that's why I said there's no such thing as high functioning depression. You are depressed, right? And so there's now the task of putting things into practice that will help you cope with feelings of depression and feelings of sadness, right? But that the two, contentment and functioning, are different. You also have to be content and happy. Yes?
That's powerful. Yes.
Thank you.
Okay.
Okay.
Hello.
Diane, do you have a question?
Yes.
Hi, Diane.
This is the same. What happened, right? From ever since they diagnosed me with it in 2018, right? Because the doctor said didn't know what it was. Because I go to many doctors when I had get this on my skin, thinking was something I eat or I drink, right? I went all on the beach. And I met a white lady when I came up from the water, and my skin was burning me from head to foot. And she told me, she said, darling, that what you have is lupus. She said that can take sun and salt water by the beach. I said, well, I go to many doctors and they never tell me what it was. But I had a skin doctor from Trinidad that's come to the hospital. And when I went to her and tell her what it is happening with me, she did a biopsy and she told me when it come back, she'll let me know. But she told me it was 2 types I have. Right? I can't remember the type, but one is a skin type, I have things on my skin,
Yes.
and one is an immune system one at the skin.
Right. So both just to educate you here, it's called systemic lupus and discoid lupus. Discoid lupus affects just the skin, and of course, systemic is all the organs in the body. Okay, go ahead, Diane. Yes.
And from ever since I get it, in 2019, when my son said, see, I started to fall sick more, right? Right now, I have get like a spasm to the face, to the mouth, and it's like I can't chew. So like I using like mashed potato, pumpkin, wheat a bit and these things, but it has get to me because when I see the family eating different things, I can't get to bite it, I can't get to eat it because it turned to, it's on my tongue bad too. My tongue started to get dark. It's still dark and I get a lot of pains and it's right through.
Yes.
I cannot get to do nothing that what I want, how I want. If I go tongue or I go clinic, from the time I meet and I come home, all the foot swell, the hands, if I holding anything in the hands, it's like it's swelling. And I can't get to move around how I want. It's every day my body paining me right through. It's not giving me ease at all, even though I'm taking the medication, the paracetamol and the other medication the doctor gives to me. It's like, I don't know, like it's not helping me. I tell my husband because I have sugar with it. I was not a diabetic. But when they did the thing, they told me is the lupus that what caused the sugar to come down. I started to get seizures with it.
Yeah.
I just get memory loss. Sometimes my son show me something on the phone. It's like I have to call him again because it's like I can't remember, right? And this is what's happening to me. Like I can't get to function, and I don't know if it's that what happened me like just in a maze that how I was to how I get now. It's at times I can't walk and them things. he just had to feed me at times, bathe me at times. When the one to the stomach take me, you know, I just get a lot of pains. All now, so I'm getting pain all in the night when I lie down. I just get the pain. I just can't get to sleep. Because when I turn, it's like I'm bawling for the pain and I don't know what else to do because I have other surgery to do into my eyes because I had cataract and they're supposed to do the other eye. But it's like, I don't know what it is going on. I just can't remember at times. Things like from long time, I remember, but like things now, whatever I talk or if I lie down and I think about something, when I get up, as I think I have to tell my husband or my son or anybody because it's like when I tell them and I come to tell them a while after, it's like I don't know what it is. I'm telling them because I can't remember and I just tell them I can't remember what it is. So I don't know if that is because of the seizure and with the lupus, if I'm getting that with it. Because I really don't know what it is causing these things on me. Sometimes I ask the doctor what it is. And he will tell me it's just the lupus gaining the pains. Because many times I go to the hospital, casualty, they will tell me the same thing. I say, well, I find I getting these pains too much. I don't know why it is. It keeps coming on like that and have me right through the day. Even my neighbors just come to look for me to find out, Diane, how you're feeling, how things. I said, girl, I said, the body said just one like you don't want to function.
Yes.
It thing right now, I can't raise the hand how I want to take off my clothes. My husband had to help me or my son want to go by the neighbor to take, I asked you to help me to pull off the jersey because the hands cannot go straight up. Like from the shoulder to the crease of the elbow, that part not raising to go up when I try to stretch. If I try to hang clothes, I cannot get to hang the clothes or pick it up. I have to ask somebody to do it for me. So I don't know if it's because of the pains I'm getting that or anything. And with the mouth, the teeth and them started to drop out and things. So I had to end up by dentist to go to get them out.
Yeah.
Because I never had any teeth was shaking or anything and they start to shake and ting my mouth. And it's because I can't eat, the dietitian had put me on can't chew. She put me on like pumpkin and mashed potato with a bit. And sometimes I doesn't eat, I drop a lot of weight. I drop a real lot of weight.
Diana,
So how I was.
Yes, I thank you so much for, just sharing in detail the struggles that you're going through. And I think this is a conversation that the rheumatologist that's seeing you needs to get involved, because maybe there needs to be an adjustment with some of the medications that you're on, because some of the symptoms that you're describing sounds like the side effects of some of the drugs that you might be taking, and it might be a case of the dosages may not be adequate, or it might be too high because, for instance, the issue with the teeth and even with your eyes and all being diabetic, chronic use of steroids, long-term use of steroids causes so many other complications. So I know you are in Tobago. You are not the only patient from Tobago joining us.
Yeah.
I will definitely keep in touch with you. I want to encourage you. Thank you so much for sharing. I know how frustrating this journey is. And, I just really want to thank you for being so honest.
Yeah, because with my skin, I don't like to watch my skin at all, and I don't.
Yeah, and you're very real here, because a lupus patient messaged just now, and she said, she stays away from people because people tend to ask, "Girl, are you looking so small? What's going on with your skin?" And that causes her to feel a level of overwhelmness, anxiety, and that's why she keeps to herself. And another question, you talked about seizures. Someone also, a patient, is asking what could be the cause of a person experiencing seizure-like symptoms or seizures without it being recorded on a ECG or EKG. Dr. Mata, I don't know if you can talk about that, if you have any sort of advice on that. And I think that would be a neurologist would have to speak really on those things. But could seizures mimic that of mental problems going on?
Well, it's really quite complicated and complex because there are what we call psychosomatic symptoms, meaning that physical symptoms or symptoms that mimic physical illnesses that are rooted in a psychological dysfunction. So, for example, someone might say, I don't know why, but I am getting pain in my stomach. The pain won't go away. I eat, I still get the pain. They check, they've ruled out all medical issues. No ultrasounds are showing any sign of, ulcers, nothing is showing up. You would likely be referred to a clinical psychologist for assessment because there are a number of ways that the brain tries to make sense of what is happening to you. And sometimes when we're dealing with trauma, we're dealing with the experience of chronic illness, our brain starts making our body react as though we are sick, even when there's nothing wrong. Now, I'm not saying that this person may not actually be having a seizure. It may just not be able to be recorded, right? But there's also the possibility that the body is mimicking seizure because the person is not processing a traumatic experience adequately. And the brain and the body is starting to physically, it's like your brain lashing out, right? It starts to physically create psychosomatic symptoms. So it's something that she would have to be assessed, yes.
Right, so in a case like that, she would have to be assessed, right? Someone is asking, for those who are in chronic pain constantly, have daily brain fog or face frustration after frustration constantly, how to convert negative thoughts into positive ones?
Right, and so that would be, we practice something called thought stoppers, right? When a negative thought enters your mind, and remember what I talked about earlier with regards to thoughts are not facts. And we went in detail at looking at challenging a thought. So thought stoppers, what is the thing I can say to myself that stops my negative thought in its tracks? So sometimes you might just have a simple saying, a word, right? It's just a key word that you give yourself when your negative thoughts are out of control. So for example, a first negative thought enters your mind. I see somebody behind me. You're walking down the road, right? I notice somebody behind me. Your first thought, that person looking at me. That person looking at me and wondering why I'm looking so. That person looking at me wondering why I'm looking so. They're going to cross the road. I feel they're going to hurt me. They're looking like they're going to hurt me. I better run. Oh no, I can't run. My leg's hurting. And before you know it, your thoughts have spiraled out of control and they're all negative. You need a thought stopper, something that cuts off the negative thoughts. Sometimes you see on TV, they give you a little rubber band and you pull the rubber band and snap it back. It's used as a thought stopper, right? So you need something like that. That's either a word, a fidget, something that you can physically touch if you're a physical person. If you're a visual person, you need something you could look at, but you need something to arrest the negative spiral and bring yourself back to, is this true? As what I'm thinking, does it make sense? Does this person know me? No. Then maybe it's not what I'm thinking. And remember, I talked about the difference between your intuition and a negative thought spiral. And what, you might have instinct and intuition, but that is different from if your negative thoughts are overwhelming you. Yeah? Sorry, so Melissa just had one comment quickly in the chat, just asking if you should hide yourself from the public because of the comments that people make. So Melissa, I would challenge you with the same coping strategy that we talked about earlier. Draw up your circle of control, Melissa. What is within your control and what is outside of your control? What is in your control is your choice whether or not you want to hide from the public. What is outside of your control is what people are going to assume to be true about you, what people are going to think, what people are going to guess, right? Because if you started putting on weight, they'll immediately say, well, she must be pregnant, right? If you start losing weight, oh gosh, you must be sick with something, right? So people are going to think what they want to think, no matter what you have to say about it, right? But what is in your circle of control is whether you hide. But Melissa, I will tell you that it is important for your survival to take control and to have control, because you can't allow Lupus to kick your ass. All right. And that's right. That is as simple as I could put it.
And real.
It's real. It is important for you to have control. And control in this regard is being confident and going out there because other people's thoughts are not in your control.
True.
And so I would say it's your decision whether you want to go out or not, but reflect a little on what we talked about earlier and then decide.
Right. I just wanted to correct myself when I mentioned the question about the seizures. The test for seizures is not an EKG, but an EEG.
Yes.
Right. So just wanted to correct myself. Someone wants to know, can negative thoughts really increase your pain and cloud your thinking? And how does it happen psychologically? What are the benefits of positive thinking? And how does positive thinking differ from toxic positivity? I remember asking you.
Yes.
Because this is the first time I heard something of you mean toxic positivity. What's that? Is that real? So how would you?
Yes, so 100% accuracy on your negative thoughts being able to affect you physically and affect how you feel physically, make you more sick. It does every single time, right? Which is why we go through such lengths as clinicians to help provide coping strategies. And those coping strategies are to prevent or reduce how many negative thoughts you have about yourself and about your situation, because health and being healthy requires positivity. All right. Now, how does it work psychologically? Psychologically, our magnificent and wonderful brain has what we call neural pathways, right? And those, think of it like a map. Like if you're looking at a Waze map, and when you plug in directions to somewhere, I want to go to Brian Lara Stadium, right? And you go to Brian Lara Stadium every morning. Eventually, as you open the Waze map, it will put in the directions and tell you time to Brian Lara Stadium is, right? And give you, because Waze, the app, has learned through repetition how to respond to you. And your brain does exactly the same thing. It takes negative thoughts and forms a pattern. And each negative thought you have reinforces the pattern that your brain is making about you and about how you respond and interact with the world. And so your brain comes to expect and anticipate that your next thought will be a negative thought. And it presents that in advance for you so you don't have any work to do, right? Here's your negative thought for the day, all right? And so just like a little pop-up reminder, because that's how they train apps, right? Apps are trained through repetition because apps mimic the brain and how the brain functions. So when you give the brain enough repeated actions, it begins to just do it on its own now for you so that you don't waste the energy and the carbs, right? To have your brain process that. It just presents, here you go, here's your negative thought, enjoy. All right. So yes, that's how it works psychologically in a nutshell and very simply put without describing every part of the brain. And toxic positivity. Yes, it's a thing, right? So I'm sure you've encountered somebody that have said to you, just take one day at a time. I don't know, you just have to will yourself to feel better. I know you could do it. Just try. You just need to try a little harder. One foot in front of the other. All those little little quips, right? And little phrases. When you are having some of the darkest days of your life, here comes this person to say, you can do it. I know you can, right? There's no try without fail, and all these silly little phrases that people throw about very callously. Um, that's called toxic positivity. It is the form of positivity that is unhelpful because all the person is seeking to do is to vomit positivity on you and not listen, right? So that person isn't actually providing any help or support. All they're doing is throwing stuff at you to make themselves feel better. And that's the toxic part of it, right? So yes, very, very true thing. Sometimes people try to help, but what comes out is that, stuff that they read off the internet.
Someone on Facebook who's joining us, hello to our Facebook audience. Someone is saying she's a lupus patient. So because I'm more stable, my in-laws think that I should still conceive at the age of 48. Is silence the best way to deal with them? My spouse is contented with me just being alive. Wants to know how to treat with the in-laws.
Communication comes back to communication and advocating for yourself.
She wants to know if
If
it's too
you
quiet. She should just
no, absolutely not. Now, sometimes we passively accept our situation, we passively accept our relationships with people to maintain them. And so I know in-laws, I have many, many clients who talk about or who beg for help in dealing with in-laws because it's such a tricky little river to navigate. You say one thing and sometimes it's received a totally different way. And there's some people who are blessed to have wonderful and amazing in-laws, right? Amazing in-laws who are supportive and understanding. But many, many times there are in-laws who have difficulty with boundaries and wanting anybody to conceive, to grow a human being inside of their bodies is crossing a boundary. When you are not the spouse and you are not the person that has to grow this human being inside of you, wanting that from someone else is demonstration of unwillingness to respect where that person is at in their life or the circumstances and situation that person is living with, right? That lack of respect and the lack of respect of boundaries must be addressed if you want the relationship to work. Silence never really, it just sits there, it festers, and then eventually it comes out in a huge brawl, right? And you say all the bad things that you wanted to say that pent up there for forever, right? And that never helps anybody either, because you would find that family is one of those things that you don't pick, but you sometimes need. All right. So I would say silence is never the way to go. Communication is key, but we're not talking about the kind of communication where you yell all of your darkest thoughts. That's not communication. That's not emotional health, right? What I would suggest is that you sit, put pen to paper, write out what you're thinking, write out what you're feeling, and then put it together in what you think might be the healthiest way to share with them how you feel. Because sometimes the thing that comes out first isn't quite the thing that you want to see, right? So you might want to say, just leave me alone. My husband happy. I don't know why you're not minding your business. And none of that is really what you want to say, because what you're feeling is, I already feel inadequate. You asking me to conceive makes me feel more inadequate. I don't want to feel that. So if you stop, I will feel better. If you love me, you will stop. And that's communicating and advocating for what you want, rather than saying, la, 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 right? So, yeah, so that's what that I would say. Absolutely no on the silence.
Yes, no on silence, right? And what better way? We need to learn how to be our own advocates, isn't that correct? Yes. Right.
Yes.
A patient who's in the professional field of nursing wants to know how to cope with low competence when it comes to work, parenting, and contribution in your family. How to deal with the feelings of depression and anxiety that comes because of low competency.
Right. So one of the things, and that's, I know for me, would be incredibly difficult, especially when you're passionate about your job and you are passionate about, and it's important, your work ethic and the way and the quality of the work that you deliver is important to you. I can see that being very, very frustrating. What I would say is that we did talk at the very beginning about the effects of lupus and how that can affect your ability to do basic day-to-day tasks. Your general thinking is affected. And so it may not be an issue of competency at all. It may be an issue of you are experiencing neuropsychiatric lupus, and it's affecting your mental state because you're having trouble making decisions. You're having trouble remembering the steps that you might need to do to complete a particular task, and you're having difficulty just thinking, problem solving, and thinking through something that you ordinarily or before would have been able to do without a problem, right? That person is not the only one that feels like they're an incompetent parent. That's a human condition, right? I talked to many families and parents I talked to. Every mommy and every daddy worries that they are not good enough parents. And the fact that you're worrying about it means that you're a good parent. Bad parents don't worry about if they're being bad parents, right? But if it really becomes something that affects your ability, meaning that you stop doing it altogether because you're afraid that you won't do it well, then that's something that you have to seek help for. That's something that you're going to have to talk through with somebody, because a psychologist will spend a couple of weeks with you walking through how do you go from being insecure about your competency to reclaiming some of that strength and power for yourself, and being accepting of where you are at now and what you are able to do. Right? So that's, hope that answers those questions.
All right, we want to wrap things up. Just have two more questions. One of them has to do with, someone wants to know, trying to interpret this question. So basically they're asking, who can intermediate with patient and workplace when patients are put on medications that have negative side effects?
Okay, so are we talking negative psychiatric effects? So for example, is this person having bouts of depression? Is this person acting out at work? Is this person having angry outbursts? Is this person's mood altered to the degree that they might be a threat to the other people that they work with, right? So there are lots of questions to be asked about the drug, and helping your employer understand how the medication affects you. Usually a good person to do that would be a doctor. Now, I know that sometimes that might be a hard ask for someone in the public healthcare system, but it might be worthwhile to ask your doctor if they can just write a letter to your employer describing what they can expect and why you may or may not be, may or may not have any issues completing your job. Because your employer usually is primarily concerned about whether you can do your job. And if you are asking for leniency and you are asking for your employer to give you consideration because you can't do that in the way that you used to be able to, then a great mediating person would be a doctor, because they can best describe what your employer can expect from you. And then it's your employer's decision, or up to your employer to decide whether they are okay with that. And then that gets stuck in your circle of not control, meaning the thing that you don't have control over will be how your employer responds and whether they are okay with that or not. But I would say, or the person that immediately comes to mind would really be a doctor to be able to describe that. We don't necessarily have mediators outside of medical social workers that might be willing to fulfill that role. So if you are assigned a medical social worker for counseling, usually, I don't know how it works, Rihanna, if you are able to access counseling through a health center from a medical social worker, but maybe
not all the time, because I remember when I was going to the San Fernando Teaching Hospital, I had a medical social worker, and I had to wait months before I could get any kind of mediation in terms of help. So I don't, and that's a couple of years ago, so I don't know. And maybe patients who are online, and maybe if you could share your experience, it'd be very helpful so that we can guide patients when they ask for support like that. So if anyone can, I know we have a nurse here who works at the San Fernando Teaching Hospital. I wouldn't identify her. If she would like to just based on her knowledge, just let us know. It would be helpful. Monique, we are focused on patients. I want to discuss those who are caregivers, spouses, living with someone with lupus. Lupus does not just affect the patient, it affects the entire household. What would be your advice to a husband or wife who has a significant other living with lupus, them to be able to effectively support, and how to support? Because I think that's a struggle. I have been getting a lot of calls from husbands and wives of patients. They don't know what to do. They don't know how to support. They don't know what is expected. How would you treat that scenario in terms of speaking directly to a mother, a father, a husband, a wife of someone living with lupus?
So there are two things that I would say here. The first is, again, going back to my favorite coping strategy of radical acceptance. Because as a spouse, a caregiver, a friend, a boyfriend, a girlfriend, you need to accept what is happening, even more so than the patient. Because in order for you to give of yourself, because that's what will be required of you, you must give of yourself to support this person. You need to accept that everything that they have said to you about what they're experiencing is true. And I find that I get the most resistance from spouses and partners who don't quite believe it, right? And spouses and partners who are in denial or who are second guessing, well, when my wife say pain, what kind of pain she mean, right? So the first thing that a spouse or partner has to do is accept it. You must accept that when your wife says, or when your husband or your boyfriend or girlfriend says, I am in pain, imagine the worst kind of pain and go from there, right? And the second thing that I would say is to ask. Many people who are trying to help or who want to help don't ask how the person needs to be helped. What people do is offer help in the way that they want to help. And sometimes that's not the way that the patient needs your help or the patient needs your support. Ask. That's where it comes back to communication as well. And communication is both ways. How do you need me to help you today? What do you need from me? And the patient, it's your responsibility to clearly say, I need you. Don't just say, I need you to be supportive. You're not supporting me. That doesn't tell me anything. The word support doesn't magically bring clarity, right? You need to be specific with what help you are asking for. I need you to pick up this box for me. And I need you to pick up this box for me every day. I need you to open the door for me. And I need you to do that every day. So that you as a patient don't find yourself asking for the same kind of help over and over and over to your own frustration. And as the person who is helping, you get to preemptively do some helping. So if you know that there is going to be struggle and pain, if the person has to stand in the kitchen and cook, then your help can be, do you want me to do some of this? Would you like me to order some food instead? Right? Whatever provides help in the way that the person needs it is help, not the way that you want to do it, right? So you might, as a caregiver, you might say to yourself, well, she just wants some quiet time. So I will just leave and go out and give them the quiet time, right? Is that helping? No, it is not helpful because the person has not said to you, I want to be left alone. The person has said to you, I need some quiet, which means I still want the presence of you there because your presence is reassuring and I feel good when you're in the house. But I just want you to be quiet because I don't want to hear you talk. Right? So you understand the difference? How you help, it's important to get that instruction from the person when you're a caregiver. Yes. Or else both of you end up frustrated and wanting to strangle each other.
Yes. Someone just sent a private message and they're saying, okay, so I've just been diagnosed with lupus, fairly new. I heard what you said, Doc, but still, how to move forward in accepting my diagnosis of lupus. Tell me. That's basically what they said. Tell me, ball by ball, step by step, how am I really going to accept this diagnosis?
Well, so I was not going to end this session with bad news, but that's not how it works, sweetheart, right? This acceptance is a journey that you go through. And we're not just talking about accepting what you're feeling, but accepting that this lupus is now a passenger. You are a vehicle, you have purpose, and you have power, and you have direction. But this thing is going to be a passenger sitting in your front seat like a shadow all the time with you. Accepting it is accepting that it is present. And that takes a while. And I'm sure patients with lupus will tell you, it took me 6 years, it took me 5, 10, 7, 14 years before I could accept it. Because the acceptance part is a journey. And so when I say radical acceptance, you are accepting your feelings, your true feelings, your disappointment that you have it, your blame. I don't know why me, why this couldn't happen to somebody else, your frustration, your anger, your sadness, your hopelessness. You have to accept all of those things as part of you and your new reality. And that does not happen in a week, will not happen in a few days. It will happen with time and a long time. Because what can happen as well is that you accept it and then you relapse. Because we know how relapses work with chronic illness, right? You're going good and then bam, something, you fall right back down the slide, you start the uphill climb again. Acceptance is like that too.
Yes.
Sometimes you forget that you accepted it, right? And you meet somebody and you want to go and live a particular way and be with this person, and then you remember, shoot, I can't, right? I can't do this. I can't have this life. And your acceptance has to start all over again. So it is a journey and it does take some time. So I don't have a ball by ball or a step by step, right? It is a process that you and you alone. And I would say journaling helps a lot when you're just been diagnosed. Journaling helps a lot. You start writing down everything, every bad thing that you think, every bad thing that you feel, every frustration, every hurtful word you want to say, write it all down. Yeah?
And we are going to intend to leave this with a positive. So I would like to just, before we allow Monique Marta to get to her family, and it's been a long night. She has stayed on a whole hour and a half extra here. I just want to make sure that everyone is comfortable with the information. Do you have any questions? Because when she says goodbye, I can't answer your questions. So please use the opportunity, as she's here for another 5 minutes, just 5. If you have a question, ask the question, and let's allow her to gracefully leave our presence. Any questions? Sparkle, I saw that you unmuted your mic. Did you want to say something? Vindra, do you have any other questions regarding advocating with the medications, that sort of thing?
No, sorry. That was an error that I unmuted. Sorry.
Okay, no problem.
Thank you very much, Doctor. Thank you very much.
No problem. I'm seeing Ravi here. I'm seeing Sajjad. Sajjad, do you have any questions as opposed to, a perspective from a spouse, someone, on the outside, but yet inside, seeing, your loved one deal with a diagnosis of lupus. If this is an opportunity that you'd like to speak, we would love to hear your perspective in terms of, you're the husband of someone living with lupus, seeing the highs and lows. Are you comfortable? Feel free to, say something if you can. Thank you to everyone who has been here. I'm not going to delay any further. If there are no questions for, we're speaking at Dr. Monique Marta. I know you're still doing all the studies and what have you. Wish you so much. And thank you so much for, just being so available, Monique, available, your availability. We could not have paid you for your time. Thank you for choosing the organization to give back of your specialty. One of the things that I wanted to ask you personally has to do with my own mental health check. Running an organization like this for me has been very, very difficult because I'm dealing with so many situations with patients. I'm talking from really extreme sadness, really despair, hopeless situations where I don't even know how to help. I don't even know how to begin to help. Also rejection, dealing with rejection as a leader, dealing with rejection even from the community that you're working hard for. Any advice? And I openly wanted to ask that because I know that there are many people looking on who face that same thing in a different light, not leading an NGO, but in their own personal life, the inadequacies, the feeling not good enough, not you feeling like, okay, so why is it people are rejecting me when I'm trying to help? And I really struggle because it's a lot. Doc, it's a lot. May I lie on your couch? It's a lot. It's a lot. The rejection from the lupus community is a lot in terms of not getting the support, not getting the, I think that the word you just taught me here, support, means many things. Persons coming together to build the organization, to push the organization, to support in terms of jumping on when we do projects like these, webinars, like, how do I deal with that? Because it affects me.
So the interesting thing is that rejection and physical pain hit all the same areas of your brain. And so rejection feels like physical pain. It's the one emotion that really feels like physical pain. That's why when you get a tobacco, is roll up, right? In your room in a dark corner and you don't want to see nobody, you're not eating nothing, you're not sleeping. It's because rejection comes from the same part of your brain, right? The same signal is given. So because it can feel like pain, physical pain, you have to stay mindful. And that mindfulness is really about what you're expecting to get based on what you give. Because as a helper and as a giver and as a leader, it will never be equal.
No.
What you give and what you get will never be equal. And so it's important for you to take inventory of what you expect. So because the rejection really happens and the disappointment happens because you expected something. And it's important to be honest about expecting something. It's okay. It's okay to have expectations, right? Yeah. But you have to be honest and you have to say, I expected John to come and help me set up the computers so that I can do this session, right? That was the expectation. John said he didn't have time. But here I am, already short on time and doing it for myself as I always am. The question would be, why do you expect that from John?
Yes.
Right?
Yes.
Because John's actions, John's thoughts, behaviors, beliefs are all outside of your control. And if John has demonstrated to you that he does not feel the same passion for helping that you do, then it's not right for you to expect John to be that, because John is not that, right? And so when we expect things from people, when we expect people to be something other than who they are, that's when we feel disappointed.
And I think the expectation is just as how I suffered as a lupus patient, but I chose to pioneer and change the narrative of what lupus was, and also to establish a support group for persons to get help, a place where they can come to get help. I think in my head, just as how I've been able to look at it, the bottle is empty, but it's half full, if you know what I mean. I think there is that expectation that, or the passion. I expect those in the community I represent to be passionate about wanting to tell people about lupus and make them understand, and so others don't have to suffer like we did when we were trying to navigate through our diagnosis, and it's very tough. I wanted to ask you about post-traumatic stress disorder. There are many women in our group who have mentioned very confidentially that they have been victims of sexual abuse as children and trauma. You are an expert in trauma. How can someone who has been severely abused as a child, physically, verbally, mentally, emotionally, in their adult life, later rest that aspect of life and move forward in a healthy way, dealing with post-traumatic stress disorder?
So intervention and treatment for trauma is a long process. And it happens over multiple sessions for an extended period of time. Usually we work with about 2 years, right? When we're dealing with a person, adult or child that suffered severe trauma. Now, and we touched on, and this is really, again, its own session, because I think we did trauma as its own session last time, right? Because there is evidence, strong evidence to suggest that significant trauma in early childhood can induce lupus.
Yes.
All right. Now that's a really, really big statement to make. And it is backed by research and evidence, but it requires a lot of examination and exploration to show how it might get to that, right?
Yes.
So we don't want to quite dive into that yet, but the experience of trauma and its connection to lupus can't be ignored. And so when you are living with lupus as an autoimmune condition, trauma is almost always a default examination of your history, your psychosocial history.
Yes.
Right? There are questions to be asked about what you have experienced. And many times we find that culturally, trim baked onions are not able to say what trauma is or what trauma they've experienced because they don't consider it to be trauma. So when you've gotten licks as a child and the licks was with a piece of stick, with the timing belt from the car, with the broomstick, those things that we talk extensively about the limits of, on the fine line between discipline and abuse, right? Discipline, simply put, discipline is when your aim is to correct the child. Abuse is when you get off on it, meaning that you get some satisfaction from the child crying. The crying is making you feel better, like they're somehow learning something. You're doing something, right? You're fixing them. That's when it's abuse, because the intent is no longer to discipline and correct. All right? So, but there are lots of Trinbagonians that cannot confirm that they've experienced trauma, because they don't consider divorce and separation of parents as trauma, because they don't consider experiencing and living through the coup as trauma, because they don't consider being abandoned by one parent who went to the US and sent barrels every month trauma. But all of those things are trauma. And they were traumatic, and your feelings of abandonment and your feelings of neglect, and why you are suspicious of your spouse and worried that they will leave you and abandon you because you are ill, stems from feelings of abandonment. And when you tell your spouse, you know, I don't know, I just don't think you could deal with this. This is too much for you. That comes from, those thoughts comes from your childhood. Those thoughts come from things that you have experienced in your childhood with regards to the people that were responsible for your care.
Yes.
And so when you find adults who will in multi-sibling homes, meaning that you had 3, 4, 5 siblings, and you were stuck somewhere in the middle, and you never really felt like you were the favorite, because as much as every parent denies it, they really do have a favorite, right? They have a child that they get along with better than the rest. So even when they don't want to say is a favorite, there is a child they're a little more proud of than the rest, right? And so that child, in the adult version of themselves, looks at their spouse and says, I know I am not good enough for you. I know that you don't want to deal with me like this. Because that comes from feeling inadequate for the better part of your childhood, watching your mother or father be favorite your sibling, right? So when we start drawing connections, the connections can run deep.
Right.
And it takes a while to bring it all out, because it's hard for people to identify those experiences unless we work at it and work at it and work at it. Because many times it's very, very deeply hidden, right? And it's things that you try to forget and you try to suppress. And the suppressing of it is what manifests as illness as well, right? So there are medical, now this does not exclude any medical causes, right? So your body shutting down is your body shutting down. But we're also talking about how your traumatic experience can manifest as symptoms, all right? And one of those symptoms as well would be psychotic symptoms, would be depression, would be suicidal thoughts and ideation, would be anxiety. All right, so you're thinking of this thing runs deep, basically, yes. Right? And that's why it takes 8 years to study, but it understanding yourself and what you are living with really does, it would benefit you to understand your childhood and your past. Not to make you feel worse about where you are now, but to give you perspective. Why do I say these things? Why do I think these things? Why do I believe these things?
Yes.
Right? Because that affects how well you are mentally as an adult right now.
Okay. I love that.
Yeah.
Thank you very much. I really appreciate the insight personally for me, because you know, we are all a work in progress, and as a leader, it's very important to identify what your shortcomings are and work on them, you know. So thank you again, Monique. If there are no other questions, I'm just asking you to stay on just a little bit longer, even though Monique is going to leave. I just wanted to just discuss a little bit about some of the some resources, how you can help your loved one with lupus. I think it's a very important discussion. I did a webinar just a couple of days ago discussing in detail, you know, some of the steps that you can take today to better support your loved ones living with lupus. So as we say our bye-byes and thank yous to Monique Marta, clinical psychologist, as well as trauma specialist, thank you for spending all this time to us. Someone wants to know if they want to you know, access your services in the future, how can they go about this? I know you are working within the justice system and what have you, but if we want to see you privately, how can we do so?
So it's a little bit complex because I'm seconded on a contract with the judiciary. And it's sort of a dedicated arrangement. But I do have to think about ways or options to maybe offer services privately. But I, to be honest, I have not tried to set anything up.
Yes.
Because it really can be quite time consuming to just fulfill my current obligation, right? Because I really treat every single child and family that is involved with the justice system right now, either through criminal involvement or protection, child protection of any kind. So it can get quite, you know, extensive, but I will see what options might be available, and I will speak with Brianna.
Yes.
In the coming weeks.
Yes.
I know that I've been very vague and skittish with this question. But,
yes, I do. Since our last session, a lot of persons had reached out asking, you know, for your information so that they can, you know, book a meeting, a one-on-one with you. But definitely the resources that you sent, someone is asking if the presentation would be made available. So if you can send us some of the, you know, especially the fingers, I love that in terms of the support, and then the ones with the circle, you know, what you can control, what you cannot control, as well as I think it was the last two slides, in terms of, you know, just some tidbits of and resources that persons can download. And we'll share it. We'll take a photo of them and just share it on our social media, as well as send it out to our patients. We really enjoy this, and I hope everyone feels empowered enough to go through the journey of living with lupus with a little more hope. We have to have hope in this life. We have to live in hope every day. And I hope that's not a toxic positivity statement. I learned that important term, because when I saw it, I asked Monique, I called and I said, oh my goodness, I wonder if, you know, my positivity and the way I speak, because it's hundreds of you all, it's over 1,000+ patients I speak to almost on a daily basis. Am I coming across as toxic positivity? You know, but as a patient, you know, I know that there is a level of empathy and genuine love and care for patients, you know. So again, thank you. And we allow you now to go. And, you know,
right. Thank you very much for having me.
Thank you. Thank you. So we're going to still be on here, guys. You feel free if you want to leave. Bye-bye, Monique. Thank you again. So as I promised, some of the coping strategies, because I know that joining us, we have a few lupus patients and their spouses looking on. I would have touched on this a couple of days ago, but definitely education, educate yourself about lupus, work together with your loved one to better understand the disease, Work on healthy communication. Lupus is a big and extremely big adjustment. Make time to talk about how the transition is going to affect you. Create a care file system and develop a daily care plan. So when a person, if you are taking notes, you know, you can let me know, I'll go a little slower. When a person with lupus develops serious health issues and can no longer function independently, someone will need to assume the role of a caregiver. The more you know about lupus and how to cope with it, it is better prepared you are to be a good caregiver. Understanding the disease can make the initial transition into caregiving a little less intimidating. Of course, it can also help you determine a caregiving plan that meets the specific needs of your loved one. So when we talk about understanding lupus, while learning about lupus is ongoing, because every day you learn something new, there are some things that you should focus on first. Some of that includes: one, educate yourself about the nature of lupus and the symptoms of the disease. Be aware of how lupus is affecting your loved one physically, emotionally, mentally. Pay very close attention to changes in symptoms or physical conditions that may suggest a flare. A lupus flare is when the symptoms of lupus are at its worst. Be open to change. Living with lupus usually requires certain lifestyle adjustments. Yes, when you met your wife or you met your husband, he was a busybody, a best buddy. But because of medications, because of steroid use, because of the nature of the illness, they have changed their body. I mean, for those of you who know me before lupus, I was half the side and I was woo, woo, woo. I mean, I still woo, 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 but I just look like a Gelita bottle. Bad manners, right? So persons need to be very mindful of the changes and the adjustments that come with a diagnosis of lupus. Be emotionally considerate. Feelings of sadness, helplessness, and uncertainties about the future, as Dr. Marta said, it's normal and it's part of living, especially with chronic illness. Your loved one's understanding of the disease can make a difference in how you lend support and, of course, how they prefer to receive it. By working together to understand the disease, you can create a plan to cope with lupus. Helping your loved one learn about lupus has other benefits too. Some people with lupus feel guilty. We feel guilty about needing a caregiver, and the demand that a caregiver or getting a caregiving person will be placed on you. Learning more about the disease may help them to understand the impact of lupus and may be too large for one person to deal with alone. Sometimes you need to have an entire community behind you. And I think if Louise is on still, Louise can testify that it takes a community or a village to support her through her diagnosis, as she shared with us recently. Going through the learning process together also strengthens your relationship. A strong relationship can help them feel more comfortable receiving care, especially if decisions are made together about caregiving needs. Communication. It is normal to experience changes in moods, relationships, and activities within the family. Through it all, caregivers can use good communication skills to respond appropriately and keep up a positive attitude. Healthy communication allows family members to connect with each other and share feelings. So I'm going to list some key points to remember. So make sure you are aiming for a healthy exchange of information, which is different from venting emotion. Talk about major problems caused by lupus, what is most feared about the disease, and your loved one's needs. Reach out to others. It's a good way to gain support and share feelings, especially within your family and circle of friends. Be open about your needs. Ask others for help. I have to take that every day. That's like a dose of medicine for me. Asking for help. It is important for you and your loved ones to communicate in a positive and hopeful way, but it is also important to be realistic and adjust to a new normal. I know that's hard. It's a new normal. Instead of expecting to return to normal. So before lupus, there's no going back. Make time to talk about this transition and how it is affecting you. Now, a lot of people don't do this here in Trinidad, but we need to get in the habit of creating a care plan or a care file plan. A care file or plan basically provides access to essential information. Your medications, how often you're taking those medications, what you're allergic to, where's your personal information, whether it's your bank details, designating of someone to act if you are in a coma, if you are on a ventilator. You need to have these things written down and stored somewhere that is a file someone can open, pick it up, open and see, okay, these are the medications. This is the dietary restrictions. This is what you can and cannot eat. This is what you're allergic to. This is how many times you need to take your meds. And of course, where your birth paper is, where your bank cards are, passport, that sort of thing. Reduce stress. That's easier said than done, but we need to learn how to reduce our stress levels. Save time and energy by sometimes allowing those details to be digital. Whether you scan certain documents, you WhatsApp it or you email it out to your auntie, your mother, your sisters, your brother, your father, your husband, your in-laws, so that they have access to certain crucial information concerning your well-being and, of course, the way you are being treated for your condition. Again, personal information, birth paper, identification card, bank details, if you write a will, all these sorts of things. Let's be real. Lupus can go south anytime. So you need to be prepared. And this is why I am going to spend time telling you, educating you, how to plan properly. So if anything happens, your family are not running around like headless chickens, fish out of water. Well, I don't know, I see she's swallowing a whole handful of pills. I don't know, doc is red, blue, and green. I don't know, doc. Trust me, it has happened. So you need to make sure that whoever you have designated to be your caregiver, let them know where to find your medicine or the names of the medications, how often you are taking it, as well as what you are allergic to. Your girl here allergic to penicillin. I am allergic to shellfish. I'm allergic to sulfur-based drugs. So I have to make sure I have something, whether it's my wallet, I have to go and get something for my hand that says I'm allergic to these things, because if I were to drop down unconscious, who will talk for me, right? So we have to be better prepared. Emergency contacts. That's very important. We need to designate persons who can act on our behalf when we are sick. So those are just some of the plans that we are suggesting, that you make sure you have key pointers in terms of making note. And I hope that the information that we've shared, keep in mind, of course, major problems, healthcare needs, describe specific caregiving tasks, necessary tasks to be completed, make sure that family members and friends and stuff like that are communicating with each other during emergency situations, as well as allow, and this is for patients, Allow flexibility of your plan to change, okay? You know, some of you are very stubborn. Some of you are very own way. Allow flexibility and to receive help, okay? So guys, thank you very much. I really enjoyed the session. I'm very happy that it went well and it has served all of you in a very positive way. And I hope that going forward, we can truly, truly win in our journey with lupus. So thank you so much for those of you who choose to stay. I am tired, so I'm going to start messing up with my words. So before I start to continue to embarrass myself by stumbling with all my words, and I start sounding like various nationalities of the Caribbean, I will say goodnight to every one of you. I wish you a wonderful evening. Thank you. Be very good to yourselves. And I'm seeing Philip Arthurly joining us here. Thank you again for being here. And my friend over in the Marylands of the USA, thank you very much for being here. Thank you for all of you who continue to stay on. And of course, we are hoping that our Let's Talk Lupus series continue. I am trying to cement a time with Dr. Keisha Davis-King, our well-known rheumatologist here in Trinidad and Tobago. I'm also trying to see if I can get on to head of the organ transplant unit. He's also a well-known, well-respected nephrologist, Dr. Sean Lynch, to continue our discussion, continue our series, to educate you, John public, as well as our patients about our condition. So have a good night, everyone, and take good care of yourself. Bye for now.